Good afternoon, everyone. This is Christina at Health Current, and thank you for the electronic prescribing of controlled substances, the Click for Control campaign. Today's presentation, another look at House Bill 2075, EPCS mandates and requirements. We are muting all lines, and we encourage you to use the chat feature to ask questions throughout today's presentation. Just a reminder, a copy of today's presentation will be sent to everyone. Our presenter will have her contact information as well. Hyde, who is our Director of Programs at Health Current, will be presenting today.
I am, Christine. I am. Thank you.
Wonderful. You're very welcome.
All right. I'm so excited to be able to do another round of House Bill 2075. I get a lot of calls from folks asking a lot of questions about what can I do, what can't I do, you know, what's required, what do I have to do. So I wanted to go through again House Bill 2075 with everyone. We've done this several times, but it's important to do it again. And based upon the number of folks who have registered for this webinar today, we do need to do it again. I do want to let you know that we partnered with the Arizona Healthcare Cost Containment System, which of course is ACCESS, as well as the Arizona Department of Health Services and the Board of Pharmacy to manage and coordinate the statewide EPCS Click for Control campaign. We recognized early on that many folks needed help getting the software that they needed and then being able to get up and going on it, and then also to understand how what the requirements were from the bill. So let's take a look at what we have for today. I want to go through a review of the mandates and responsibilities review. What I did was I gathered it together by medical practitioner, pharmacist, and then things that affect both the medical practitioner and pharmacist, also the physician assistants, certified PAs, because the original bill, which was Senate Bill 1001 back in 2018, had some erroneous information about physician assistants and what they could do and couldn't do. So I've included that in this presentation so that those folks are up to date on what really needs to happen. Also, I want to talk a little bit about the Controlled Substance Prescription Monitoring Program. A lot of times you will hear it referred to as the PMP. So that's an important thing for the opioid crisis, as well as helping you, as you will see as a prescriber. It will help you with a lot of things. I have a few new EPCS statistics to share with you. And I also want to talk about the EPCS benefits for subscribers, pharmacies, and patients. So that will be very interesting. I found some information about it and thought that you all would like it as well as I did. And then I want to share with you a few Click for Control campaign resources and tell you a little bit about some things that the Health Information Exchange, which is our parent company, are doing regularly. All right, let's take it going with this, and let's take a look at medical practitioners' mandates and responsibilities. So beginning January 1, as most of you already know, 2020, each prescription order needed to be done that is an opioid, and I'm going to repeat this to you exactly how it's written in House Bill 2075, and it is any prescription order that is issued by a medical practitioner for a Schedule II controlled substance that is an opioid must be transmitted electronically to the dispensing pharmacy. Understand, there are no waivers any longer. That was part of the original Opioid Act that Governor Ducey signed in 2018. There are no more waivers. There's no way around either e-prescribe or don't prescribe controlled substances. You'll also notice on the bottom of every one of the, not every one, but most of the slides, you will see where it says House Bill 2075, right down in the left-hand corner. it is section 36, line 2525. So that will tell you if you want to know about something that's on the screen and research it, which I encourage you to do for your particular practice. That's what those little numbers down in the corner mean. So also for prescribers, beginning January 1, you have to have your name, address, and your federal registration number, your FDA number, of the prescriber on the form, not the facilities, but the prescribers. And it can only contain one drug. That's a little bit different for hospital inpatients, may contain multiple drugs. That's so that you don't have to send home, when you're discharged from the hospital, they don't have to send home a million different pieces of paper. I know for myself and my husband's discharge from hospitals, reading the discharge orders can be a challenge, so it's good to know that you will only have one list of drugs to take home. Medical practitioner limits and requirements. Again, initial Schedule II controlled substance prescriptions, you can only write them for 5 days. So I know when I've been a lucky recipient of a new knee, I got a 30-day supply of controlled substances, opioid, which nowadays you can't do any longer. You can only do a 5-day supply. And there are a couple exceptions. You can do a 14-day supply following a surgical procedure. If it's an oncology diagnosis, and if it's a traumatic injury for pain management, you can prescribe more. Also, the initial Schedule II substance prescription limited to 5 days except hospice patients and end-of-life situations, palliative and/or skilled nursing facility patients, burn and MAT treatment patients. MAT, of course, is a medically assisted treatment for addiction, and infants, poor little babes, being weaned off of opioids. So those are basically the medical prescriber, practitioner, or prescriber limits and requirements. Now let's take a look at what the pharmacist has for mandates and responsibilities. I don't normally get a lot of pharmacists attending these webinars, but I think it's important to include the information in case we have one, but also so that prescribers and providers understand what the pharmacist is limited and responsible to do. Pharmacist limits, if authorized verbally by the prescriber, the pharmacist can make corrections to the following things: the date it was issued, strength, dosage form, quantity, and use directions. If they make that change, any of the changes, they must keep track of the time and date the prescriber granted authorization to make those corrections and write them on the original order. That's very important for pharmacists. You need to keep track of that and understand if you're the prescriber, you need to provide that to the pharmacist. And you probably want to keep track of it as well yourself. Again, limits and requirements for the pharmacist, not covered in this presentation. I just want to make it clear. For compounding, there's nothing in this presentation for compounding. They're still working on figuring out how they want that done within the state. I'm not familiar with how it's being looked at. I know there's a committee that's looking at it. As soon as I find out any of the information about compounding, I will get it to all of you. We have your email, so we can send out an alert and let you all know about it. Also, I didn't cover anything for long-term care facility residents or hospice care. And I didn't cover, which I don't understand what this even means, but it's also something that's in the House Bill 2075, controlled substances dispensed to consumers. And I didn't cover the veterinarians because the 2075 changed the veterinarians from having to prescribe electronically until such time as the veterinary board determines that there's enough software available for the veterinarians to prescribe electronically. I don't think it's a real hardship right now for veterinarians because most of the time veterinarians don't prescribe. they dispense. So they're still covered under their present requirements on how to dispense. I think it's interesting that more and more, I understand, more and more veterinarians are beginning to prescribe so as not to keep the opioids and other drugs in their practice offices. Okay, let's take a look at medical practitioners and pharmacists. So this is what refers to or covers both sides of the fence here. Schedule II substances dispensed only with electronic order, as we've said many times, and most of you already know that, may not be dispensed more than 90 days after the date of the prescription order. That is very important, especially in a state such as Arizona, where we have a lot of snowbirds. If you're sending a patient home with a prescription, remind them that it must be filled within 90 days after the date of the order, or it can't be filled. And remember that also for snowbirds coming into town that are trying to get an order filled that is not, that is over 90 days. They may not be refilled as well. So any Schedule II controlled substances may not be refilled. And that's important information for both prescribers as well as pharmacists. Written Schedule II controlled substances. When can you do it? Medical practitioners can write and pharmacists can dispense when the electronic prescribing, that's on the prescriber side, the practitioner's side, is not operational. Pharmacy management system is not operational, and both must maintain a record when the systems were not operational or available. So if the pharmacist system is down, the prescriber should keep track of that. And if the prescriber system is down, the pharmacist must keep track of it so that they can verify that they were prescribing or filling because of a system error or electronic systems being not operational. So in emergency situations, quantities for Schedule II substances can be orally ordered and dispensed. Again, the pharmacist must transcribe the oral prescription order and keep track of all the information except the medical practitioner's manual signature, of course. So I suggest that folks get a book or a journal and keep track of all those kinds of things. I know of some folks who have gotten those kind of binders that you can slip pieces of paper in the two covers, the back and front cover, and then also the 3-ring binder down the middle. That allows you to keep copies of things that you printed, as well as record dates, times, etc. When things have happened, like if someone has orally ordered or if the systems have been down. So more information about subscribing controlled substances. It may not be dispensed more than 90 days after the date of the prescription order. That's very similar to what I've said before. That's very, very important. I know of situations where the 90 days have passed and a patient is trying to get a prescription filled and the pharmacist cannot dispense it. So keep that in mind and remind your patients of it once you do the prescribing. And again, I remind you, it may not be refilled. Emergency situations quantities may be increased if it's orally ordered and dispensed. And then, of course, the prescriber must deliver written or electronically prepared order, get it to the pharmacist within 7 days. And again, that's a reason why a pharmacist may want to keep track of it as well as a practitioner, so that you can make sure both sides have been covered. Some other situations when a practitioner may write and a pharmacist may dispense. All federal facilities are not required to do electronic prescribing. So in the state of Arizona, of course, we have a couple different VA facilities, our military base, St. Luke's for one, Indian Health Service hospitals and other Indian Health Service facilities or tribal-owned clinic patients. You're not required to electronically prescribe. And keep in mind, those facilities don't have the ability to receive electronically prescribed, so you do need to keep track of making sure that you're doing it written wise, and understand that make sure that the person you're giving the handwritten prescription to understands that it can only be filled at a federal facility, not at a regular Arizona pharmacist or pharmacy. Now let's talk a little bit about physician assistants. As I said, in the original Senate Bill 1001, there were errors and mistakes for physician assistants, certified physician assistants. So when House Bill 2020 came out, it was corrected. So I want to go over a few of those. Certified physician assistants can only prescribe 30-day privileges for Schedule 1, 2, 3, 4, and 5 controlled substances that are opioids or benzodiazepines. Again, very specific in House Bill 2075 that are opioids or benzodiazepine. 90-day prescription privileges for Schedule 2, 3, 4, and 5 that are not opioids is in force for the physician assistants. And physician assistants limited shall not prescribe, dispense, or administer for more than 5 times in a 6-month period for each patient. That's very valuable information, and your EHR or your e-prescribing system usually alerts you to those kinds of things. Also, Schedule 3 controlled substances that are opioids or benzodiazepines that are filled without written consent of the supervising physician cannot be refilled without written consent. And prescription drugs for a period exceeding 1 year. Again, legend drugs. Again, for our snowbirds, make sure that you're paying attention for that. And if they're bringing in handwritten prescriptions from another state, you want to make sure that you're not filling it for over 1 year. More physician assistants shall not prescribe, dispense, or administer without the delegation of a board supervising physician, which is both board approved and USDEA registration. Prescription-only medication without delegation. In other words, legend drugs, you must have a delegation of a supervising physician. And I often get asked, do they have to sign each form? No, you just should have something on file, a letter or something, or some way that you can let your board, let the physician assistant board know that you do have your supervising physician and what the name of that person is. If a pharmacist would ask you, you need to be able to tell who your supervising physician is. Prescription medication that is intended to induce abortion is forbidden by a physician assistant. And I included that in here because many physician assistants are also midwives, so you need to understand that you cannot prescribe that medication. You would need to get your supervising physician to prescribe it for you. Physician assistants must maintain an up-to-date and complete log of all Schedule 2 and 3 controlled substances that a physician assistant administers or dispenses. That's so that you, again, can keep track of that in your book or some other electronic way of keeping track of it. Sometimes folks that when they do their medication management forms, they can also use those to keep track of what they have dispensed or administered. Also, you can see House Bill 2075 section 322532 for emergency situations, MAT, and dispensing guidelines and mandates, as I talked about a little bit earlier. And also, all physician prescription orders must contain the physician assistant's name, address, and phone number, and DEA registration number, not the supervising physicians. The physician assistant must use their own, and if you're prescribing from a facility, you may not use the facility's DEA number. It must be your physician assistant DEA number, and that goes without saying as well for prescribers. You need to use your own DEA number. Physician assistants must, in order to prescribe controlled substances, must complete 45 hours of pharmacology or clinical management of drug therapy within the preceding 3 years of their licensing, or is certified by a national commission of physician assistants. And there are several different different national commissions. That's why I've included this here. And as well, you must meet all established board rules for the state of Arizona physician assistants. Now let's take a look at some statistics for Arizona and the nation, some that I thought were pretty interesting. This, I think, is rather interesting. So opioid prescription rates have declined, and EPCS, electronic prescribing of controlled substances, has increased 36%. So you can see for the little graph there that you can see the source of it is from SureScripts. In 2017, there were 33.2 million electronic prescriptions written for opioids. And in 2019, there were 67.7 million prescribed. And that is, I'm sure, increasing because of all the different states that are beginning to require that that controlled substances are EPCS or electronically prescribed. For example, there are 13 states which have enacted the EPCS requirements in 2019, so that's more than half of all the states are now requiring e-prescribing of opioids. So I imagine by now there's more than 13 states, so we're past the half mark, half of all the states it's really gathering up. I'm going to show you a little map of the United States in a few minutes that will help you understand which states are and which states are not required. The advances, there's a federal act which is called SUPPORT. It is the Substance Use Disorder Prevention that promotes opioid recovery and treatment. That act is in force. It isn't a whole lot different than the requirements for the state of Arizona. In fact, the state of Arizona is a little bit more strict, and the SUPPORT Act will require all prescriptions that are covered under Medicare Part D. They will have to be electronically prescribed by January 1, 2021. I'm not real worried about our Arizona prescribers because at this point, I believe that every prescriber in the state of Arizona who wants to prescribe or is prescribing opioids that are Schedule IIs that are opioids are electronically prescribing, or the pharmacist wouldn't be filling the orders. So I think we're pretty well over that hump. So everyone in the state of Arizona should be covered for January 2021. One of these days I'm going to look up, see what SUPPORT is requiring in addition to electronically prescribing, see if there's anything else specific. From my initial cursory review of SUPPORT, as I said before, the Arizona requirements are stricter than the national, so we should all be covered. And here's a cute little map I promised to show for you. As of July, unfortunately, I wasn't able, the results for August 2020 have not been released yet, so I wasn't able to update the slide for August. But we still remain 4th in the nation. Iowa is ahead of us. They are number 3. New York is number 1, and Maine is number 2. And if you see this little map, you can tell by the different shades of the folks, the different states, who's winning and who's losing. I would love to see us back up at, we are one step above where we used to be back in, I don't know, 2012 and 13. We were 5th in the nation, so we are now 4th in the nation for e-prescribing of controlled substances. by prescribers. Here's the next slide. It'll tell us a little bit about pharmacies. Pharmacies nationwide are 96. In Arizona, we're 99%. Prescribers, however, we've changed a little bit. Nationally, 52% were in June, it was 52%. Now in July, it's 55% nationally are EPCS enabled. And in Arizona, we were at 72%, we're now at 74%, so we're going up a little bit. However, if you look at the box below, Arizona prescribers were 20% ahead of national numbers, and now we're 19% ahead of. And that will continue to change as more and more states are requiring electronic prescribing of controlled substances, and of course, as more and more prescribers nationally began to prescribe EPCS. So, e-prescribing benefits for pharmacy providers, pharmacy prescribers, and patients. I thought this was interesting, and I thought I would share it with you. So, instant notification of allergies, drug reactions, duplicate therapies. This is important because many of the systems that do the e-prescribing have alerts that alert prescribers of allergies, drug interactions, therapies, pregnancy, all those kinds of issues, so that you know immediately when you're prescribing that you have those notices so that you can avoid those kind of interactions. Prevent prescription drug errors. I was surprised at a statistic I found on this one. It is estimated that 7,000 to 9,000 patients die every year from medication errors. So by prescribing electronically for both controlled substances and legend drugs, you can you'll have better than illegible handwriting. You'll avoid drugs that sound familiar because you're looking at typing rather than handwriting. And there's a lot of other things. E-prescribing both helps with giving the patient correct medication. So that's a very important point. The next one is easily prescribed controlled substances. Controlled substances in pharmacies, the same procedure used for both e-prescribing of legend drugs as well as e-prescribing of controlled substances. So if you're doing both of them, you've got everything in your EHR in the same spot. You've got everything that you need together, and it increases workflow efficiencies because you don't have two different areas that you have to go through when you're doing your monitoring and your also monitoring controlled substance prescriptions. You can keep track of the number of prescriptions, and also if you use, in the state of Arizona, you should be using, because it's mandated, the Controlled Substance Prescription Monitoring Program, which is a registry that you sign on with. And I'll talk a little bit about that later in the presentation. Also, reconcile medication histories quickly. You can do it almost instantaneously because you've got all of your e-prescribing together, both your legend drugs as well as your controlled substance drugs. And it saves time reconciling all your medication lists if you're keeping other ones. Also, it helps meet meaningful use requirements. Those of you who are enrolled in the priority, I can't even think of what the name is, the PI program, the Promoting Interoperability Program, for stage 2, you're required for 50% of prescriptions to be sent electronically. For stage 3, it's 80%. So by doing both electronic prescribing of controlled substances as well as legend drugs, you are it'll be easier for you to meet those goals if you're in the PI program. And I have a few more of them that I thought you might be interested in. You can easily track prescription fulfillment via your EHR because you'll have everything all together. Because you're e-prescribing everything, both the controlled substances and non-controlled substances, You don't risk the loss of prescriptions. Patients don't have a paper they have to keep track of. They have their, they just go directly to the pharmacy and it's there. It also spends less time for doing prescription refills for patients who run, and also, and this is important, for patients who reside in other areas, as well as if you're traveling, you can call your pharmacy or your doc and have them prescribe to a local pharmacy wherever you're located at the time. It's very helpful. I've had that done traveling to Washington for CMS meetings. I've had to get a prescription filled. Just had them fill it at the Walgreens across from the hotel I was staying at, ran over there, picked it up. It was very slick and very easy, and I was very happy I was able to do it. I left my prescription at home, so keep that in mind. And also, it's great for our snowbirds. Pharmacy and practice employees spend less time calling to verify orders because most of the orders are done well, and it provides the e-prescribing software provides drop-down menus which will prompt the prescriber to fill in all the vital information, so the pharmacy doesn't have to call back and say, you didn't give us the patient's date of birth or any other of the information that would be required. And then you easily prescribe medications that are covered by insurance. Most of the e-prescribing systems nowadays will allow you to go in and choose, see the formulary for the patients for most of the major insurance companies. So you'd be able to see what the costs are, make sure that your patient can afford the drug that you're prescribing. You know, many of our Medicare folks and even Medicare Advantage folks fall into the donut hole, so they can't afford their prescriptions or are not happy with having to pay double or triple what they were paying before. Also, there are fewer costs that if the patient incurs fewer costs, they're more apt to fill their prescription. Also, reduced readmission risk. Most of you probably know this, that 20% of hospital readmissions can be traced back to adverse drug events. So by making sure that everything is safely written and all allergies and duplicate therapy alerts are followed, most of the time you will find that you have that 20% can be reduced, at least for your patients. So hopefully that gives you a little bit of ideas for those of you who may not be e-prescribing your legend drugs. I was really shocked when I was talking with a group of orthopedic surgeons just recently, and many of them were only doing the non-controlled substance, but we're only doing e-prescribing of controlled substances, not the legend drugs. And I asked why, and they said, well, we're not going to change and do that too. After I talked to them a little bit about being able to do one medication reconciliation and all of those kinds of things, they were a little bit more interested in taking on the e-prescribing of legend drugs as well. I know I'm the same way. None of us like to make change, but if you bite the bullet and go at it, you might help everyone be able to keep their medication and do their medication as they should, all of your patients. All right, hopefully that was interesting. I thought it was very interesting when I originally saw the information and looked it all up. So let's talk a little bit about controlled substances, the Controlled Substance Monitoring Program, a lot of times called PMP. What is it? It's a database that's run by the state, and every state in the union has one, including Arizona. And it's run in Arizona by the Board of Pharmacy. What you're required to do is you're required to go to it and access information and look to see the prescriptions for opioids or benzodiazepines that have been prescribed for that patient within the past 12 months. What you will find is it will reduce doctor shopping, inappropriate prescribing. It gives you an idea if you have someone that is close to becoming addicted. It will help you be able to understand that very well. A little bit more about it. Like I said, you review the preceding 12 months before prescribing so that you can tell how many prescriptions that patient has from other doctors, yourself as well. You know, yourself when you're seeing 15, 20 patients, sometimes more a day, and you do that every day, you can't quite remember who you have prescribed a opioid to recently. So you may want, checking the PMP allows you to see that information. Also, medical residents may register using the hospital's DEA number and appropriate suffix so that they can tell. But prescribers must register, and there's a link here. If you go to the pharmacy, I've given you the link on the bottom of this slide, and review the information there, you will find out how to register, and they've got several, let me drink here. They have several little training videos that will help you get registered. It's very easy to do. Everyone is using it, and even those, many folks were using it before when they were only prescribing written prescriptions, and before they started e-prescribing before January 1 of this year. So I encourage you, if you aren't doing it, you better get doing it, because your board will be after you if you don't. There are also several different ways that you can connect. The best way, of course, to connect is through your EHR. Lots of the EHRs are now including it so that you can transition directly from your EHR into the PMP and then back over again. I gave you the link to the pharmacy board so that you can look up to see if your EHR isn't offering that. You can look at an interest form there and fill it out if you'd like to. You can also get to it via the Board of Pharmacy website. I've given you the link for it there as well. And if you are a Health Current HIE participant, then you can get connected through the portal. But obviously, the very best way is to be able to do it through EHR, so you don't have to go to a different system to check the PMP. You can do it right between the two. The additional information is on our website as well as the Board of Pharmacy website. I've also included an opportunity for a free online continued medical education option. It's kind of cool because you can, I've given you the links here, you can go on and do it and pause in the middle and get back to it at a later date. So it helps you be able to get through your CME more quickly. And you can start it and keep going, stop, do something else, and then come back to it. A little bit about the Click for Control campaign. There's a lot of information on our website, and also on the, there's some information on the Access website, as well as on the Board of Pharmacy. Lots of different fact sheets and different news articles and things, the slides to any of our presentations. And also, if you want to include anything about e-prescribing of controlled substances in any presentations you're giving, either internally at your practice or if for some club or something that you might belong to, let me know. I'd be happy to share some slides with you. Also, please know that we are available to present at any of your meetings and also any of your events that you might have, or any of your association meetings, and we do not charge for that. Also, our folks will come and speak about the Health Information Exchange if you're interested in that as well. We also provide free phone assistance. All you have to do is call, and I'll give you, in a few minutes, I'll show you a list of how to get in touch with us. I answer probably it's down to about 20 to 30 calls a week now for EPCS. And I get maybe 5, 6, 7 emails a day for information about e-prescribing as well as EPCS. Some of the things that are on our website are fact sheets and flyers that will give you information about EPCS. Not too many folks are using them anymore, but we've left them up there so that if you have to talk to somebody about it, you can provide them with a flyer. And I wanted to let you know for the rest of 2020, we have a few more webinars. We're going to be doing one each month. In October, we're going to do a webinar about why it's important to do both electronic prescribing as well as legend drugs and controlled substances. So if you do both of them, it helps you. So that's what the October webinar will be about. And then in November, Lynn Curtis from the Board of Pharmacy is going to talk about, again, about the PMP and go through the benefits and requirements again. And also in December, I want to do a complete review of all of the events that we've had and all the information we've shared with you, just kind of a quick run through. I also want you to know that I really suggest that you take a look at the House bill so that you know what it says and not to just go completely on what it says in what I've shared with you in this webinar. So I encourage you to view and interpret the legislation and mandates based on your specific situations. I also wanted to let you know that the HIE, we are doing COVID-19 alerts so that folks know when someone is coming to their office or to the hospital. If they have been positive, then you will get, you can get a alert, real-time alert, letting you know that you have someone coming who has been positive on their results. So I'll let you, read these as you go along. And if you're interested at all, I'll share with you some information on how you can contact Health Current to find out, can you belong, can you join the Health Information Exchange. The Health Information Exchange does not cost you anything to join, gives you access to your patients' information from many different facilities within the state of Arizona. I encourage, as well as a bunch of other states as well, I encourage you to go on our website and take a look if you are not a member of the HIE. Also, I would encourage you to consider attending our 13th Annual Health Current Summit and Trade Show. It's October 13th and 14th, and it's all virtual, so you can do it from sitting at home in your pajamas if you want to. So I urge you to take a look at that. As promised, here's our information. You can contact me. I've even given you my cell phone number because I do work from home during the pandemic. So feel free to leave a message for me at my office number there, 602-688-7210, or call me directly on my cell phone. But I ask you to have mercy on me. Don't call me in the middle of the night. Try to keep your calls on my cell phone during business hours. I'd appreciate that. And as I said, if you're interested in joining the Health Current HIE, there's an email address for you there, and there's a number that you can call and ask for our recruitment person, who is Jamie Pima. She's a wonderful young lady and understands the HIE inside out and backwards. So please at least call and find out about it. Again, if you are a single solo practitioner or a large clinic, please look into joining. If you are a community physician, in other words, not a hospital, you are not charged. It's free to join the HIE. So check it out. I've also added a little bit of information on the end here of additional resources and information. here's the information for the original House Bill 2369 that allowed everyone to be able to e-prescribe in the state of Arizona. House Bill 35, National House Bill 3528 is called the Every Prescription Controlled Conveyed Securely Act, and that is coming up really fast so that everyone will be required in the state of Arizona, in the nation, to e-prescribe controlled substances. Also, I've given you the text, bill text to the opioid original bill, which is Senate Bill 1001, and also a policy primer, which is it's a PowerPoint presentation that kind of cuts it down to layman's terms that you might be interested in. And then House Bill 2075, which went into effect January 1. You can click on the link there and you will be able to see the House Bill itself, and then you can use those little numbers that I told you about on the bottom of each screen. I'll go back and point them out to you here quickly. I can find one. These down, as for example, down in the left-hand corner there, that will take you to House Bill 2075. I'm going to put up my contact information for a bit, and I'm going to ask Christine, do we have any questions in the chat box?
Yes, Connie. The Arizona opioid prescribing, I think it's the azrxed.org. Their modules appear to have expired on June 30th of this year. Do you know if they're going to be updating those modules at all? I don't think I realized that they have expired, but
I will find out about that and then send an email to everyone who is on this and probably included in the next e-prescribing newsletter. I didn't know that. Unfortunately, or very sadly, the director of the Osteopathic Association, who worked very diligently with the Arizona, with ASU, creating that modular, has passed away, so I'm not sure where things are with it, but I will find out and get back to you all. Thanks for the question. It's a good one.
Thanks, Connie. Again, everyone, the chat box is open. If you have questions for Connie Ide, our Director of Programs, we would encourage you to post them in there. Everybody, a few minutes for that. Again, thank you for that information. We really appreciate that. And again, Connie will circle back with the group today on those modules and any update on the education that's available through the organization.
This is Connie. If anybody has questions after this meeting, I think, Christine, you can go ahead and close out. If anybody has questions after this meeting, please don't be afraid to call me and or email me.
Wonderful. Thank you so much, Connie. Thanks for everyone's participation today on our EPCS prescribing programs. We do have more events that are coming up, and you can visit the Health Current website at healthcurrent.org/events and register for additional upcoming webinars. Thank you again, Connie. We really appreciate your time today. We thank those for participating. Stay safe out there, everyone, and have a wonderful day.